morning, before the sun appears, before the world has even stirred. Let's get out of here. We don't need to hurry.
Good evening. My name is Suzanne Pearce and I'm one of the corporate nursing directors here at Diaverum. I'm talking with you tonight from the UK. It's with great pleasure that I welcome you to the third in our series of webinars, this time on health literacy. At Diaverum, we firmly believe that kidney disease, whilst a serious condition, does not mean that you have to give up on all your hopes, goals, ambitions, or dreams. On the contrary, we believe that living well with chronic kidney disease is possible. Back in May, on our last webinar that you can still watch on our YouTube channel, we explored, together with 3 patients, strategies for renal patients to manage their disease effectively and live fulfilling lives despite their condition. This time, the webinar will feature special guests Nicola Thomas, who is a professor of kidney care at London South Bank University, and 2 of our patients, Oscarine, who is a life coach and an author and a Diaverum patient, and Raul, who is a retired paediatrician in neonatal intensive care and a Diaverum patient. Oscarine and Raul have completely different experiences as renal patients, but they do have one thing in common: health literacy that helps them to have a fulfilling life. And they are here today to discuss how health literacy can help with managing chronic diseases. I'm now going to hand over to my colleague in Sweden, Michaela, who will cover the logistics for this webinar. We've a lot to get through in this hour, so she will guide us through the steps to ensure it's as smooth as possible for us all. Over to you, Michaela.
Thank you, Susie. And as Susie just mentioned, I will be your host throughout today's session. A session that I have a personal interest in, being a specialized nurse in the field of nephrology. Allow me to just quickly run you through some short housekeeping rules to make this a pleasant event for everyone. This webinar is planned for 70 minutes. All attendees' microphones are off to maintain a high quality event. In addition to the questions that our speakers will cover as part of their presentations, the Q&A functionality is open throughout the event. So please submit any questions of yours at any time. Your questions will be visible only to you and our medical team. While we are very happy to answer questions, we will not be able to answer any questions regarding specific medical cases and refer those to your doctor. So over to you, Professor Nicola Thomas from Sweden and back to the UK.
Thank you very much indeed for the kind introduction. I'll just explain a little bit about myself before we get on with the slides, but as has already been said, I'm a kidney nurse. I work at a university in London, but I've worked in the field of kidney care for all my career. So I've spent a lot of time in dialysis. I now link with a big hospital in East London in the UK, so I do a lot of projects with them. And I also teach. So I have quite a varied and exciting life, a busy life, but I'm really delighted to be here this evening. And thank you very much to Diaverum for inviting me. So Mirek, if I might have the slides, please. I've got some assistants here with slides. So you're going to see some slides on the screen, and then I'm going to be asking Mirek to forward the slides for me. So thank you very much, Mirek. The slides, we're going to take about 15 minutes. I'm going to speak quite slowly because obviously there are people on the call who don't have English as their first language. And I'm going to use words that I hope are everyday words. So please, because the whole webinar is about literacy, or health literacy, then hopefully I'll be using words and explaining things in a very clear way. Next slide, please, Mirek. So over the next 15 minutes, I'm going to be talking about the things that you can see on the slide now. So some of you might not be very familiar with the term health literacy. We're going to spend a couple of minutes really exploring exactly what it is. We're then going to discuss why it's so important for people who live with kidney disease, whether you have dialysis or whether you've had a transplant or whether indeed you don't actually need any renal replacements yet. Most of the talk is going to be on top tips. So really how you can live well with kidney disease, and it's about finding information, understanding information, and most importantly, using information, the information you need to live well on dialysis. And I'm going to finish talking a little bit about partnerships, because healthcare is a partnership. It's a partnership between all of you who are patients, who attend dialysis units, who come to clinics, partnerships with nurses, doctors, and other people in the healthcare team. So that's what we're going to be talking about. So we'll have the first proper slide, please, Merrick. So there's quite a lot of words at the top of this slide, but really I thought it was important to give a definition of health literacy, one that is given by the World Health Organization. So I'm not going to read all the words word by word, but you will see that health literacy is involved with understanding, appraising, using information. So really generally what it means, health literacy means finding information, understanding information, and using information. Information you need to live well with dialysis. And we're going to be exploring each of those things very shortly. Next slide, please, Merrick. So before we explore each of those things, it's important that maybe we all have an understanding about why it matters. Why is health literacy important? And really what it's about having a good understanding of your condition so that then you can really live the best you can with your kidney disease. And there's quite a lot of research about this, and you'll see at the bottom of the slide there is a reference there. But very generally what it means is that you can have better outcomes if you are health literate, meaning you're involved in your condition, you find out about your condition, you really explore how you yourself can live well with kidney disease. And you will see on the slide that there are 3 examples of that. So one example is if you know a lot about your condition and you can look after yourself, then maybe you're less likely to need to go to the emergency department. It might also mean that if you look after yourself well, you actually have to go to hospital less. You don't actually need to have an admittance to hospital. And there's also some research that says people who know about their condition and understand their condition, they actually miss less dialysis sessions. And I know that all of you are thinking, well, I never miss my dialysis session. But for those of us who've worked in healthcare a long time, there are people who don't turn up for their dialysis because they don't really understand the necessity for it. And they think, well, I feel well, I don't really need to turn up today. So those are some of the reasons why it's important to have good health literacy. And really it's about living well and having a good life with dialysis and not having lots of complications. Next slide, please. So we're going to focus on some top tips now, top tips for finding information. So the first port of call will of course be your healthcare professionals, your healthcare team. And it may be that those of you who come for dialysis, the people you see the most often are the dialysis nurses. Don't ever be afraid to ask the dialysis nurses about things that matter to you. You might have a question about what you can eat. Why is your fluid allowance so little? Why are they saying to me, oh, I can only have a litre or even less than that? So never be afraid to ask your healthcare team. As I said earlier, it is a partnership. But for a lot of people, they think to themselves, oh, the nurses and doctors are so busy, perhaps I need to find some information myself. My only word of caution is that there's a lot of what I will call fake news around on the internet particularly, and you might even hear it from other, I don't know, Facebook groups, for example. I'm not saying don't go to those, but always be aware that what you're told by some people might not always be the truth, or it might not be accurate. So use websites if you're going to go online, websites that you can trust. So Diaverum, for example, or in the UK, we have a national charity called Kidney Care UK. And as healthcare professionals, we can absolutely be 100% certain that the information on those websites is accurate and helpful. And it's written in a language that, of course, hopefully people can understand. And the final place you can find information is what I call peer support. So getting information from people who also, like yourself, have kidney disease. And some hospitals will have local peer support networks. So there might be the hospital I link with, we have people with kidney disease who support other people with kidney disease. It might be an online peer support, or it might be support that's provided by a charity. So that's giving you some top tips really about where you can find information. Next slide, please. So what about understanding the information? So my top tip for this is, if you're going to a clinic visit, or maybe you're coming for dialysis, or maybe you're seeing a healthcare professional like a dietitian, for example, with a special appointment, always be prepared. So you will know that sometimes you, like me, you get into a clinic situation and you forget everything you ever wanted to say, what questions you were going to ask. So my top tip is really write those questions down. So when you go in and see the healthcare professional, you've got them handy with you. And it may be that you've had a family member saying, oh, don't forget to ask about this, and what can you eat, and you know, how much can I drink? So don't be afraid to write the questions down. As you know, sometimes when you go to your family doctor, or even when you come to a hospital, you've only got a set amount of time. So always think about how you can make the time wisely. And if you've got a number of questions, it might be at the start, you say, doctor, I'm here for 10 minutes, I know, but I've got a really burning question. Can we ask that first? Because they might be more interested in checking your blood pressure or looking at your blood results. But if you've got a really burning question, an important question for you, then make sure you ask that first. It always helps the doctors and nurses when you arrive at a clinic, or maybe when you come for dialysis, to know the tablets that you've been prescribed, and indeed the ones that you're taking. So that's always a handy hint. Maybe keep the list with you, keep the dosage. And if you don't know the names, you know, it's even helpful to say, oh, I have that white one that, you know, it's a small one and I take it 3 times a day and I take it with meals. You know, that also helps the healthcare professionals. And also know your numbers. So what that means is, for example, if you have a blood pressure machine at home, it's sometimes helpful to tell the doctors and nurses, well, I take my blood pressure at home, and actually when I come to the hospital, it always seems a bit more. So it might be helpful to go with your readings. It might be helpful if you take your blood sugar at home, if you have diabetes, to go to a clinic with that. So when you're having the discussion with the healthcare professional, it's always about understanding whether you've got the information right. But of course, you can give information to the healthcare professional as well. So information about the tablets or the blood pressure or the blood sugar reading. And another top tip is, when you finish with your time with the healthcare professional, you can always check, have I got that right? Is it right? Did you say to me that my potassium is high, or my phosphate is high, and these are the foods that I might think about cutting down on? So always check your understanding, because we know when we give lots of information to people that it's quite difficult to take it all in. And that might be because you're a bit frightened, or you're not feeling very well, or maybe you can't hear very well, or maybe the information's been given in a language that isn't your first language. So those are my top tips for understanding the information. Next slide, please, Mirek. So my next top tips are about using the information. So I would say, well, think about what matters to you, what's important to you. And I've given some examples there. So for some people, they finish dialysis and they feel really, really tired. So they might think, well, you might think, how can I stop feeling so tired at the end of dialysis? And to do that, you really need to have an understanding about why you might be feeling tired. And of course, for individual people, there are all sorts of different reasons. It might be that you've put on a lot of fluid weight at the start before dialysis. So maybe your fluid gain or your weight gain is, I don't know, 2 kilos or 2.5 kilos. And the nurses have said to you, actually, you've got a lot of fluid to take off this dialysis. We really need to get it down because your blood pressure is quite high. And you finish dialysis and you feel absolutely drained. And you think, well, why is that? And actually, it might be because there's been so much fluid to take off that you feel a bit rough at the end of dialysis. It might be that your blood count is a bit low, and you will all know, some of you will, or many of you will have injections or a way of improving your blood count. So if you have an idea about that you might be able to say to the nurses, actually, is it my blood count? I sometimes feel a bit like this when my blood count's low. It might be that what's important to you is that you'd like to eat with your family more often. You might be in a house where, I don't know, you don't do the cooking, your partner might do the cooking, and your partner cooks different meals for all members of the family. And actually you think, this isn't really a good idea. I really want to share the meal with my family. So it might be you ask the dietitian, look, these, what foods can I eat that we can all enjoy? So that would be really finding out about your diet and what matters, what's important. And the final point is about you. For many of you, I know, particularly if you're younger, you'd like to get back to work. So that's also having a chat with the medical team, with the nursing team, about how that can happen. But of course, for that to happen, you really need to have an understanding of your condition and, how long you can go maybe without having dialysis, how you could integrate it into your day-to-day life. So it's really important to know how you can help yourself. Next slide, please, Mary. So before I finish, I know that some of you may be our healthcare professionals on this webinar, as well as patients who've got kidney disease. And so I want to try and explain that it's very much a partnership. So there's a lot of writing on that slide, but hopefully I'm giving the impression that actually because it's a partnership, it's things that nurses and doctors can do, as well as things that patients and family members can do. So I'm going to go on the top line first, which is, if you have kidney disease, be interested in your health, because as healthcare professionals, that makes such a difference to us. It really helps us to have a true partnership. But that can only work if on our side, as healthcare professionals, we use words, we use language, we explain things in a way that people can understand. And something I'm very keen on is using words that really talk about what people can do rather than what you can't do. And, I hear nurses all the time say, oh, you can't have this, or you can't do that. Why is your weight so much? And really, I think, we always have to check ourselves and think about using language that's supportive rather than telling patients off. So if we go to the next line, it's about for people with, the next line, not the next slide. Sorry, Mirek. If we could go back, yes. So the next line is about for people with kidney disease, how you can help yourself. And for healthcare professionals, rather than saying, what questions have you, or have you got questions, you could say, what questions do you have? And that sort of changes it around a bit, because when you're asked, do you have any questions? Most people will say no. There are questions that are called Ask Me 3. So what options do I have? What can I do about it? What difference will it make? There are questions that you as patients can ask. And as I've said already, for healthcare professionals, we must use simple language to explain those things. I've already said, can I check if I've got this right? That's for patients to do that. And for nurses and doctors, we use a technique that when we explain things to people, we often say, now could you explain that back to me, just so that I can be sure that you've understood what I've said correctly. The next point is about finding information that you trust, and that's for patients. That's the message for patients. And for healthcare professionals, I'd say if you're developing patient information, then always involve people in developing those resources, because then you can be sure that you're using language that people will understand. So the summary of that is that we absolutely work together as a partnership, and that can happen when people on both sides, patients and nurses and doctors and other healthcare professionals, can be in each other's shoes, and that's really, really important. Next slide, please, Marek. So I'm going to conclude now. I think I've got 1 minute left. So I'd like to conclude by saying good health literacy is really important, because it can affect the outcomes, what happens to you when you've got kidney disease. It can make a difference. It can make a difference in how many times you come to hospital, how many times you might have complications, how many times you might go to the emergency department. So I would say be ready, be open to find and use the information on the issues that matter to you. Because working together, we're all a team. Thank you very much. So Merrick, if we could take the slide, yeah, thank you, the slides off, because we're now going to have question and answer with our two fantastic patients. I hope you'll excuse me, I'm just going to take some water. So we've got two fantastic patients with us. We've got Oscarine, who we can see on the screen, and we've also got Raul. So Raul, if you could turn your camera on. Oh, excuse me. Raul, I don't know if you can turn your camera on. Okay, well, perhaps while he's doing that, we'll start with Oscarine. So Oscarine, those of you who weren't here at the beginning, oh, we've got Raul now, that's lovely. Hello. So I'll introduce you both very briefly again, because some people might not have been there at the beginning. So both Oscarine and Raul have themselves got experience of kidney disease. They've had renal disease for many, many years. Oscarine is also a life coach, and Raul is a retired doctor. But what I would say to those of you listening, actually, even though Oscarine and Raul are very experienced with their kidney disease and they're very involved in their condition, it doesn't mean that everybody listening will be in the same situation, because it's small steps. And I'm sure Oscarine and Raul would agree that at the start, it was all new to them as well. So it's all about little steps, about understanding your condition and managing it. So
Sorry.
Raul,
am I unmuted? Yes, I am.
You are.
Yes. Can you hear
Yes.
me?
Yes.
Oh, thank you. Thank you for
Okay.
that.
So
Yes.
Raul, we're going to start with you, if that's all right.
That's fine.
So we've spoken a lot about health literacy already. And my question to you is, what do you think are the advantages? What are the benefits of being well informed about your condition?
Yes, thank you for inviting me for this meeting. As mentioned, I'm a retired consultant pediatrician in neonatal intensive care and general pediatrics. For those who probably are not aware what pediatrics is a branch of medicine covering babies and children. I worked in pediatrics for many years, and although I did treat children with acute kidney failure, my knowledge of treating chronic kidney failure was very little. So when I developed kidney failure, my knowledge was quite basic of treating chronic kidney failure. And I had to really start from the beginning to learn about how to manage chronic kidney disease. And as Professor Thomas mentioned, there are many sites on the internet, and one has to be very careful not to get the wrong information or get outdated information. One of the good sites that I found was the NICE guidelines, the National Institute of Clinical Excellence, which assesses the medical evidence to base whatever it recommends in the management of kidney disease. And gradually I built up my health literacy. One must remember that health literacy is not built in a day. Building your own personal health literacy skills has to be a lifelong process. Remember that no one is fully health literate. Everyone at some point will need help in understanding or acting on important health information. By being health literate in the management of chronic kidney disease, I felt confident to discuss and to be involved in decisions about treatment of my chronic kidney disease. I'm going to just mention two episodes when I spoke to my consultant, which I think reflects how useful the information I gained was going to be. As my kidney failure reached a stage when dialysis should be considered, my consultant, let's see. Sorry, is the video all right? Okay, sorry, the message came across the screen here. So my consultant told me we should start on peritoneal dialysis. A lot of you will know what peritoneal dialysis is, but this involves putting a tube in your abdomen to use the peritoneal membrane as a dialyzer machine. But I mentioned to my consultant that the surgeon who had removed my gallbladder a few years ago mentioned to me that there were many adhesions in the peritoneal cavity, and he felt that this was probably caused by the surgeon who removed my kidney cancer many years previously. And I felt that the trouble of undergoing peritoneal dialysis just to see whether it works was probably not justified. And I felt that I didn't want to undergo the trial on peritoneal dialysis, and he agreed with me. We then discussed hemodialysis, and after an AV fistula was created, we had to come to the decision of when to start hemodialysis. At this stage, my glomerular filtration rate, that is the kidney function, had reached a stage which was in a gray area, which the consultant felt we could wait, as there was no definite level to start hemodialysis. But I mentioned to the consultant that I was losing weight, I had no appetite, no energy, and he felt the decision was mine to whether we should start. And he said, as your symptoms are quite troublesome, we will start the hemodialysis. So this basically reflects how useful or the health literacy that I'd gained helped me to understand the risks, benefits, and possible consequence of different opinions. It gave me the confidence to discuss and to be involved in the decisions about my treatment and care that was right for me.
Mm-hmm.
Thank you. I hope that answers your question.
Yes, a fantastic answer, Raul. Thank you. So for those of you listening, I suppose I'll just summarize a couple of very important points that were made there. So the first thing is it's about finding the information, and Raul did mention a website. It's about the sort of the guidelines which we use as nurses and doctors to guide your care. But there is a what we call a lay summary, so a summary for patients. So there are guidelines for renal replacement therapy, meaning dialysis or transplant, for example, and you can go and look there and you'll see, what does good care look like? What should it look like? So that's the first point that Raul made. And then the second point was about the type of dialysis. So Raul knew that because of a previous operation, that peritoneal dialysis might not be suitable because of the, I think you used the word adhesions, Raul, but to explain, that means sort of bits of the inside of the tummy sticking together. And the third point was really about when to start dialysis. And, you know, quite often some of you will have been in that situation, and the nurse or the doctor say, well, actually, it's up to you how you're feeling. It's not just about the kidney number, how good your kidney function is. So really, it's important to have an awareness of your signs and symptoms so that you know your own body. So some really important benefits, Raul, that you've highlighted there. Thank you. So I'm now going to ask a question of Oscarine. So Oscarine, we're going to now move on to finding information. So my question to you really is, how easy is it for you to find information that you need to live well with kidney disease?
Thank you very much for your question, and thank you for inviting me today to share my experiences. Before I answer your question, I'd just like to say that unlike Dr. Raul, I started dialysis at a very young age, and I was a minor, so my family did everything. They were in control, so they made all the decisions for me. And when I came of age, I had to take those decisions for myself. And it was very difficult. I just spent all my time and my energy fighting a disease that I did not understand because I was not interested to know what was happening to me. And to my detriment, I spent most of my time in hospital. So to answer your question, once that changed, once I decided that I didn't want to spend the rest of my life in hospital, I wanted to know what was happening to me and to be informed about what's eating me, not just being angry, you know, just being angry at this disease that I don't understand. Rather, get yourself some research, look into it, and get to know what's eating you. Once I made that decision, then it was easy for me to start looking for information, starting with my nurses, my consultants, you know, my dietitians. That's how I started. And also, if I want to dig deeper, it's easy for me. So I use reliable, you know, health information website like NHS, which is our main UK health information website. There, you just have to go and type just a key search word, and you know, immediately you signpost it. Mm-hmm. And I've also got, you also have condition-specific sites like kidney.org, kidneyresearch.org. If you want to dig deeper, you can go and research and read those about your conditions. And you go also support organization sites like kidneycare.uk, kidney work. There are many of them out there. And I know that some of you are signing outside the UK. It's the same, wherever you're signing from. And for me, it was important for me as well to get a connection with people that go through the same thing that I go through the same condition. So patient-led forum, I found this one really interesting. Healthlog.com, which is the largest social network for health. You got thousands and thousands of community there.
Mhm.
All you have to do is just find your community, just with a keyword search. And you also have, why do I use them? Because sometimes I can feel that I'm being weird, but talking to other people that go through the same thing, we share all these information. They're not medical, it's just tip, how we cope with, certain things that happen to us. The way they cope is going to be different with the way that I cope. So to know that another person is going through the same thing like I am going through, and to help each other, which is good for me. Also, Facebook groups, I go there for the same thing, just to have that peer support, that peer support information for myself, and give support to other people as well that are going through the same thing as I'm going through. And the information is there, is generally available. Like I said, what might work for you might not work for me. So you have to apply it to your own circumstances. And always check again. I always check with my consultant, with my nurses, with the team that is taking care of me.
Mhm. Thank you ever so much. Yeah, thank you,
I hope that
Oscarine.
answers your question.
Yes, yeah, fantastic answer. Thank you. I mean, just a couple of highlights, which I think is important to say again. So the first thing is about, I don't think you told me that before, that you'd had kidney disease from such a young age, and how important it is. I mean, we healthcare professionals call it transition, but it's moving from the children's services to the adult services. And that's so difficult for young people sometimes. But you highlight, Oscarine, about like you wanted to then, once you'd moved to the adult services, then find out the information for yourself, but because before that your parents or your family had done that for you. And then another important point is about the emotional support, and we haven't really mentioned that yet, but the fact that if you find other people in the same situation, that's a comfort to you, or you're not the only one. And I think, again, particularly for young people, that's important. There's a young adult kidney group, for example, in the UK, and they support each other tremendously. There are people under 30 who've got kidney disease. So some really important messages there, Oscarine, thank you. So we're now going to move back to Raul again for another question. And this question is about, what do you think are the problems that you would come across if you had insufficient information about how to manage your kidney condition?
Fine, thank you. I think, first of all, it is difficult for me to fully know what it would be like if I was not health literate. The problems I would encounter would depend on the severity of my poor health literacy. With poor health literacy, I think it would be difficult for me to understand health information or the nursing staff, doctors tell me, and the importance of taking my treatment would not be fully appreciated. And so that compliance with my treatment may be poor, and I would not realize the consequences of that. I would have difficulty facing the emotional and the physical challenges of hemodialysis. And this would especially be at the beginning, because I think a lot of patients have a fear of going for hemodialysis in the initial stages. I think people vary in how fearful it is, but and most likely I would miss attending some of my hemodialysis sessions without fully appreciating the consequences. I think this is a problem that where understanding about what hemodialysis does for you and the benefits that you get are not appreciated. I think my poor understanding of medical instructions would be a major hurdle and would make it difficult for me to recall, purely because I didn't understand at the beginning. It'd be difficult to recall and also to adhere to the health care regimes that were given to me. I probably not realized the importance, for example, of diet in the management of chronic kidney disease. Mm-hmm. Poor health literacy would probably make me less aware of the importance of having a healthy lifestyle. You know, I would probably, with the depression that occurs with the hemodialysis and the feeling of being unwell after hemodialysis, I think alcohol abuse would probably be a major hazard if good health lifestyle was not on the agenda. And I think the smoking and obesity would be other medical conditions that might arise purely because of poor health literacy. I think I would struggle because of lack of my knowledge of chronic kidney disease. I would have difficulty in informing my family about my medical condition and dealing with the impact of my chronic illness on them. I think that this is probably underestimated in the effect the immediate family has. I would find more difficult to access appropriate health services. I wouldn't know when to go to the GP, when to which other department to contact. And so I would use the accident and emergency departments, as you mentioned, Professor Thomas, that more often than normal. Mm-hmm. So by having less effective communication with health staff, I'm being less likely to engage in active discussions about my health options. This could potentially lead to my health needs not being fully met, because purely the health team will not be able to appreciate what other needs I am in need of.
Yes. Thank you very, very much. Again, some very important points. I mean, one of them that was raised by Oscarine earlier about understanding your condition, and Oscarine, I didn't mention it just now, but it was so important about helping with your acceptance of the illness and not feeling so angry about it. And Raul, you've touched on that again, you know, the importance of understanding it so that, you know, the burden, if you like, or the emotional side of it maybe isn't so much. And another important point you've made about is if you understand it yourself, then you're able to explain to your family. And we haven't really touched on that too much, but again, that's really, really important, isn't it? If an individual person, the person with kidney disease, understands it, they're able to explain it better to their close family members and their friends. So good. So the time's moving on. So Oscarine, we're going to sort of, I'm going to give you two questions in one now, really. So the first part of the question is about whether there have been occasions when you haven't really understood the information and, you know, what you did about that. And then the second part of the question, and I'll remind you about it again in a moment if you've forgotten, is really about practical examples which you could tell the audience. So the first part is about what's happened, or have there been occasions where you haven't understood the information and what you did about it?
Yes. There have been occasions. Once I was an inpatient, and one consultant was doing his round, and he came to me, to my turn, and he just went on and on and on something that I didn't understand, you know. And then when he finished, he asked me if I had any questions, and then I said, yes. In fact, I didn't understand anything that you just said. If you could just repeat that in English, because he was just talking medical terminology, things that I don't understand. So when I told him that I didn't understand it, could you just repeat that in the plain English? And he did. So it's important that when we have information, it's given to us, an average Jane like me, it's given to us in plain English, because you cannot tell that we medically trained or not when we're sitting in a hospital. So it's important that the information is communicated in plain English.
Yeah, and what's important, Oscarine, is that you felt you had the confidence to challenge the doctor and say, could you tell me that again in words I can understand? But for maybe a lot of people listening, they don't feel they've got the confidence to do that. But I think, I think that you felt confident because you yourself, you're a life coach anyway, but you understood that it was okay to ask. And it really is okay to ask. It really is okay to ask the healthcare professionals to explain in a way you understand.
Yeah, it's your health, it's your life. So you need to understand. If you don't, ask.
Yeah.
They'll understand. They understand. What was the next question? Sorry.
Yes, it was my fault asking two at once. Yes, Raul, I'll come to you in just a moment, but Oscarine, we're going to go to the audience in a minute, but to finish off, really, could you give the audience a practical example of how you've used information to your benefit, if you like? What difference has it made in terms of a practical thing that you've done?
There's a lot of things that I've done, but lately I'm just going to give you one example, because I don't know everything, but I know how to navigate dialysis, my condition. I know how to manage it. About 3 weeks ago, during dialysis, I started having cramps, and it's been going on for that past week. So I asked the nurse if I could increase my dry weight. And then they said, oh, we have to ask the doctor, because we can decrease it, but we cannot increase it. So I said, okay. The doctor wanted to have a look at me, to examine me, to make sure that I haven't got any fluid on or anything, but I knew that I was eating well. It wasn't fluid. It was just that I put on a little bit of weight. Well, with the lockdown, who hasn't? So I put on a little bit of weight, and I'm eating well, I'm exercising. And then when she came, she checked me, and then she agreed that my dry weight should go up.
So that's a really good practical example, because you knew your body, you knew that weight that we try and get you to at the end of dialysis is comprised of fluid and what I will call flesh weight, your actual body weight, and you knew that you'd been eating well and put on some of that body weight. Then you recognize that those symptoms that you had were because you were maybe being brought too dry. So that's a really good practical example. Thank you. And Raul, just briefly, because I know that there's probably lots of questions from the audience, but maybe you could finish off with a practical example of how you've used information to your benefit.
No, I think the only one that I recall was when I was going to have dialysis, and the nurse mentioned that, shall we use a bigger needle? And well, I said, why do you want to use a bigger needle? Because the fistula was still quite fairly new, and I didn't want to damage the fistula. And it's well known that you should use smaller needles. And she agreed, oh, will you keep on the needle size 16? And then she wanted to start me on, a higher flow rate and for much longer period of 4 hours. I think she was quite right, have a good flush out of all the waste products from your blood. But I told her, what criteria are you using to increase my duration of dialysis and also my flow rate? And she said, well, isn't it good to have a good flush out, get all those poisons out of your bloodstream? I said, but why? But then I kept telling her, but my urea reduction ratio is over 70. And internationally, the reduction ratio of over 65 is quite sufficient to show that your dialysis is adequate. And she says, oh, I didn't quite know that. But I thought we'd stick to, what the consultant agreed with me, that we stick with 3 hours, because I've still got residual kidney function. Mm-hmm. And my glomerular filtration rate is at 11, which is just about the cutoff point where, you should really think of having dialysis. And she agreed with me, and she said, I don't overrule your consultant and you. So I think this is an example where you can have a dialogue. Oh, I was quite thankful to her. She had good intentions. She wanted to do the best for me, put a big needle and flush all the poisons out of my blood in 4 hours. Yes. I think quite justified, I think.
Yeah.
But not for me.
Yes, all right, Raul. I mean, that's a really good place to finish our discussion, because you've really highlighted the importance of partnership there. And, the discussion was with you in the centre and then with the doctor and the nurse. And then you came to an agreement together about the number of hours for dialysis. So thank you. So thank you both ever so much. I think we're now going to have some questions from the audience. We've got, I think, I can't quite remember when we're finishing. I think it's 10 past. The hour. So I'm going to hand over to Michaela now, who I think is going to ask some questions.
Thank you. And I think I speak on behalf of all of us when I say that it's been very insightful to listen to your conversations. And we do indeed have some questions from the audience. And starting with a question for Nicola, actually. Do you think that staff should have special training in health literacy?
Oh, now that's a really good question. It's quite a difficult thing for me to answer, because I don't think we can say for everybody, every healthcare professional, they should have a formal training in health literacy. And I do a lot of teaching. I teach nurses, I teach family doctors, I teach community nurses, all sorts of different people. And I think for some healthcare professionals, I will say they sort of get it. They understand about being in the patient's shoes, about using language that's simple and clear, about having the partnership working. And as we've heard from Raul and Oscarine, actually maybe not all health professionals are as good as others in terms of that. So I think in answer to the question, I think to have an awareness of it, to know what it is, to know how to do it well, to understand what partnership working is, that's like the baseline for everyone. But there might be other people who may be a more junior staff, or people who are new to kidney care, or whatever it might be, who might need more formal training. So I know that isn't really saying yes or no, but I'm just trying to explain, why it might be very important for some people, but other people, maybe they've already got it and they don't need a formal lesson about it to make a difference.
So quite individual, perhaps. And then we have a question to Oscarine. You talked a little bit about peer support earlier. And we have a question about, have you ever experienced a situation when you could help other patients by showing a source where to find information?
Sorry, repeat the question again.
Yes. So have you ever experienced a situation where you could help another patient by showing them where to find information?
Well, usually when I talk to the patients at my clinic, you know, there are lots of brochures lying around, and I always tell them that anything they need, you know, just ask the nurse, you know, anything they don't understand. They can even ask me if I can help, you know, and I would tell the nurses on their behalf. I explain to the nurses what they mean. Does that answer the question?
I think it does, yes. It's very helpful. I think the question concerns also some people might not know where to turn for information, but we covered a little bit also before some suggestions for sources where to turn.
Mm.
And I work a lot globally, so I also know from experience that a lot of countries have different sources of information. So it's always a good thing to talk to your care team, and they can also help you in the right direction, I think. A question for Raul. You're a doctor, so understanding medical terminology is much easier for you. But what would be the advice for somebody who doesn't necessarily understand the terminology?
Yes, what I did mention at the beginning, the first question, was that to build health literacy takes a long time. You cannot build health literacy in a couple of days. You have to start from the beginning and gradually build it up. And I think the terminology, there's a limit how much you can simplify some medical words. And I think you learn terminology as you increase your health literacy knowledge. You know, you can try and simplify things, but you can sometimes lose the meaning, or the information can be lost in trying to simplify. I think the best advice I can give is start learning and improving your health literacy. In other words, start finding information and try to understand it and gradually build it up. My health literacy stage, I've been studying for the last 50 years. So, you know, and I'm still learning. You know, whereas people learn about one specific illness, like chronic kidney disease, whereas doctors have to learn several other medical conditions and keep up to date. And unfortunately, medicine keeps changing. The evidence produced by research changes how you treat conditions, so that you cannot stop learning. And your health literacy has to be a lifetime process. So I can only suggest that the meaning of the words, medical terms, has to be learned in depth, so to fully understand. You can simplify it to a certain extent, but you will really not benefit by simplifying it too much. I hope that answers it.
I think that answers it very well. And I think Oscarine also, you said one really good thing when we talked a little bit earlier, that you had a healthcare professional who talked to you and you didn't understand a single word. And I think also having the courage to say that, can you please repeat that in a simpler way, because I did not understand that. And I don't think one should be ashamed of that, because sometimes the language that is being used is really difficult, and it's important for all of us to understand the health advices. Really good. We have a couple of more questions. Are you up for a couple of more?
Yes.
Yep.
Yeah.
I think a good question for Nicola. It's a lot of talking about fake news these days. Do you think that the pandemic and all the fake news around us can make the process of finding the right information even more complicated?
Yes, it's very, very difficult. I don't want to get into any sort of a political discussion here about vaccination or anything like that. But just to explain what we've done in the UK is that we know one of the issues has been for people with kidney disease is finding information that's correct. And so we had a big working group with patients, with the charity Kidney Care UK, with healthcare professionals, to really try and identify, let's say, the truth about the issues with COVID and the impact on people with kidney disease, and try and communicate that. I mean, I know it was an online resource, and of course that, you know, we don't reach everybody with that. But I think it's, you know, maybe as a community, we need to give advice to people about how you can sort out, you know, what's fake, what's maybe not quite true, and what's reality. But as we know, with, and I don't really like to mention vaccination, but you know, there are people, and rightly so, everybody's got their own views on vaccination, but it's really questioning where you're getting that information from. And you know, I have been surprised. I mean, I'm sorry to just mention this a little bit, but in the first wave of the pandemic, I went back to the National Health Service, to a kidney unit in London, to do frontline work. And one of the things I was doing was going around and chatting to every single patient who was having dialysis. And what I was struck by was people, like where people were getting information from. And I suppose, you know, it made me realise that we've got to support people with kidney disease to help them identify what the truth is and what's absolutely fake news. Yeah, it's such a good question, but I'm not sure I really know the answer to it. I don't know if Raul or well, Oscarine, maybe you've got an answer to this. It's about sorting out what's fake news, I suppose.
I think that the advice I can give is that patients, as they're learning to improve their health literacy, they should discuss it with the health team. They should discuss it with their doctors, if they've got relations with their GP, or if they can see a GP, that is, they should discuss it with them. More often, they could discuss it with the nurse there in the dialysis unit. They're very good, especially in the unit where I attend. The nursing staff are excellent, and you know, you can then realize whether you've picked up some fake information that can be cleared by discussing it. I think there's nothing like discussing. You may have a wrong impression of, you know, how things should be done, and it could be corrected.
Thank you. Michaela, I don't know how the time's going. Have we got time for Oscarine to make a comment?
We have time for Oscarine to make a comment as well. That's fine.
Yeah, I do agree with Dr. Raul. It's important to, if you have any doubt, to communicate those doubts. Speak to your nurses at dialysis. They are the first point of contact. You know, talk to them. If need be, you can contact your consultant and clear things out for you. Yes, speak out.
I think that's a great finish off to the Q&A session. Thanks a lot for answering the questions from our audience today. And now it's time to go back to UK and Susie.
Thank you so much for chairing that Q&A session, Michaela. And my great thanks to Nicola, Oscarine and Raul. Thank you so much for sharing your thoughts and experiences on health literacy. And hopefully everybody here has learned something today. As mentioned at the beginning of this webinar, you can check other recorded webinars on our YouTube channel, and please follow our Facebook and Instagram accounts. And this will also be uploaded onto the YouTube channel after today. Thank you all for joining us on today's session. We really appreciate the engaged participation and excellent questions. You can find more information on our approach to providing care for our patients, to our response to COVID-19, and to our overall focus on sustainability at our website. And I'd just like to finish by wishing you all a good evening. Thank you so much for attending. Thank you.